Hello friends, welcome to Medicine 101. Today we'll talk about myocardial infarction. So it's one of the most vital topic regarding cardiology. Okay. So from the term myocardial infarction, from the word infarction, it's quite easy to understand that infarction defines the what? Irreversible cardiac tissue injury. Okay. So we'll see over here that irreversible cardiac tissue injury. Irreversible cardiac tissue injury. And this thing can be done by the for the different types of the plaque. So what is the concept of the plaque? Let me make it clear for you guys. So basically you have heard the term the fibrofatty plaque. Okay, so there is the depositions of you know fatty tissue, or the calcified, or the different types of the materials over here, especially the fat tissues. Okay, so this type of the things you can see over here, that that will be the plaque. Okay, and whenever you will see this plaque will just what will be over here. As a result, we'll see the lumen that will be narrow. So as a result, the for example, if we see that there is an organ basis. Okay, so if we see this sufficient amount of the blood will be not able to reach over here. Okay, or if we see these regions, that will be also what infected. This will also get infected along with this part. Okay, infarction we can say over here. Okay, now basically from the it's the very basic term, the irreversible cardiac injury. Now whatever the etiologies we can see over here, that can cause this type of the problem over here. As far as the etiology is concerned, we can say that there is ulcerations of the plaque, there may be ulcerations of the plaque, there may be ruptures of the plaque. Okay, or there may be hemorrhage of the plaque. So if we see in terms of the etiologies, what can you see over here? That ulceration of plaque, or you can say that rupture of the plaque. Okay, or you can say that there will be hemorrhage of the plaque. Hope you understood this part. Okay, what is the concept of the plaque? I already said you over here. Okay, now whenever this plaque will be over here, they will be deposited over here. As a result, we will see there will be exposures. There are various types of mechanisms. I'm not going in details. There will be exposures of the collagen. Okay, there will be exposure of the collagen. In this part, for example, just like this, the collagen fibers, within the blood vessels, there is collagen exposure. We know that intima, media, tunica, alveoli, these things. I hope you know these things, right? Exposure of collagen fiber, and whenever the collagen will be exposed, as a result, we know that is the best place for the platelet to get aggregated over here. Okay, so we'll see over here the platelet aggregation. We'll see over here the platelet aggregations. Now, whenever we see the platelet is aggregated over here, they will form on top of the thrombus. So, whenever we see the thrombus formation, just like this, the thrombus will be formed, and as a result, we will see the tissue that is present in the heart that will be infected. Okay. So, for example, the myocardial wall over here, we are talking about it. Okay. So, we'll see the infarction. So I am repeating once again that, for example, these are the ulcerations of the plaque, or rupture of the plaque, or hemorrhage of the plaque that will leads to the exposures of the collagen fiber. Okay, and whenever the collagen fiber will be exposed, the platelet would love to aggregate over there, and they will form the along with the platelet, the various types of other things that will also come over here to get aggregated with that, and ultimately we'll see the formation of the thrombus that will cause the infarctions of the particular tissue or regions. Okay, now on the basis of that, on the basis of thickness, we can divide the myocardial infarction into two types. So the myocardial infarctions we can classify in the two types. One is known as transmural myocardial infarctions. So let me write it over here. One is known as transmural myocardial infarctions. Another we can say in terms of the subendocardial. subendocardial myocardial infarctions. Transmural defines the whole thickness or complete thickness of the myocardial all over here. Okay, so if you see the complete thickness, the wall, then you can call in terms of the what? Transmural myocardial infarctions. Okay, but if you see in terms of the subendocardial myocardial infarctions, where you can say that here will be inner one third wall of ventricle. There will be problem over here. Okay, there will be problem over here. So this type of the myocardial infarctions, you can say the types, the transmural myocardial infarctions and the subendocardial myocardial infarctions, where inner one third wall of the ventricle, here the complete thickness of the wall ventricles. Okay, now we'll talk about in terms of the whatever the clinical manifestations. You can see that is the most important thing regarding the myocardial infarctions. Okay, so we need to know the whatever the clinical manifestations you can get over here. So we need to talk about the clinical manifestations. Whatever the clinical manifestations we can get over here, let me write it over. So the clinical manifestations that we will get over here in terms of the myocardial infarctions, the most important on that will be the chest pain. Okay, there will be severe chest pain, or you can write the chest pain. The special features of this type of the chest pain that can radiate. So let's suppose the chest pain is over here. The chest pain can radiate from these regions to the inner arm, or it can come to the jaw, or it can go to the epigastric regions as well. So we'll see the chest pain that can radiate over where we can say inner arm. We can also see the chest pain over the jaw, and we can also see the epigastric pain as well. Now try to understand and don't get confused. The epigastric pain, normally we understand that for the gastritis, purpose, that is also epigastric pain. But here we are seeing the epigastric pain along with the jaw pain, along with the inner arm pain. Okay, so whenever we will see this type of three combinations of the pain, we should suggest the patients to go for the ECG. Okay, so here we should say the ECG should be done. ECG should be done over here. Okay. Now the next type of the features we can see over here that along with that important that, for example, there will be some precordial area, precordial area where, okay, we can see on type of the constricting pain or squeezing pain. This type of the sensation you can see over here also in the precordial area. So constricting, and let me write it correctly, constricting, or you can say the squeezing. This type of the sensation we can see over also here, and this type of the sensation is called as the Levine sign. So this type of the sensation is known as the Levine sign. Okay, and this is known as the Levine sign. And along with that, we can also see in this patient that we'll see the pulse. It will be elevated for the sympathetic activity. Hope you know these things. For the sympathetic activity, it will be the pulse will be more over here. Okay. And the next thing we can also is the dyspnea. Dyspnea means that what, shortness of the breath. So shortness of the breath we will see for the acute pulmonary congestion. So we will see in these cases there will be acute pulmonary congestion. So as a result we can also see this type of the problem. Okay. Now and along with that we can also see the nausea and vomiting. We can see also over here. Okay. Then the last symptoms I am saying over here, much more symptoms, but I am just saying few of them. Diaphoresis. You can see also the diaphoresis. That is the what? Profuse sweating. You see the profuse sweating over here. So this type of the clinical manifestation we can see in terms of the myocardial infarctions. Okay. Now we'll see some types of the myocardial infarctions. We can see where we cannot see the chest pain. Okay. So this type of the myocardial infarction is known as the silent myocardial infarctions. Okay. So let me write it another part. So the myocardial infarctions, but no chest pain. or another name for it, that is known as also the silent myocardial infarctions. So this type of thing you can see in case of the patients who is having the diabetes or diabetes mellitus, you can say, and another the elderly patients. Okay, elderly patients. Now we need to talk about what type of the artery is getting defected. As a result, we are seeing this type of the problem are coming over there. Okay, now we need to talk about this part. Okay, now I'll talk about that part. Left anterior descending artery. So let me write it over here. Left anterior descending artery. I'm writing left and okay, let me write it over here. Left anterior descending artery. Now from here we'll see that will give the supply of the blood. Okay, basically we'll see within the apex of the heart. Okay, then we will see anterior wall of ventricle, and we will also see where the anterior portions of the interventricular septum. Interventricular, applies for my handwriting. Try to listen, then you can understand what I am writing over here. So anterior wall of ventricle is the most common type. So the most common type 1. So the most common type 1, the anterior wall of the ventricle, where this type of the blood will be supplied. And the apex, the apex is here. You can also see the pain sensation sometimes. You can also see the pain sensation. Now we'll talk about what type of the diagnosis you can do over here. So if in terms of the diagnosis you need to have some ideas. So let me write it over here. So whenever we are talking in terms of the diagnosis, we'll see over here, as far as the ECG is concerned, we'll see the hyperacute T wave. We'll see hyperacute T wave. Along with that, we will also see the ST segment elevation. We'll see also the ST segment elevation. Okay. Now we'll talk about the enzymatic findings. So see, this is on type of the diagnosis as far as the ECG is concerned. So if you just ask the patients to go for the ECG, and if you see a hyperacute T wave along with the ST segment elevation, then you can get a confirmation from that. Okay. Now we'll talk about the enzymatic findings. What type of the enzymatic findings you can see over here? I'll talk about that. Now we know that within the heart there is presence of the myoglobin. Okay, this type of thing. So we will see the elevations of the myoglobin in the patients. Okay, so if you, the patient is for the chronic, we see the patient is suffering from the prolonged terms. So you can see the elevations of the myoglobin. So as far as the enzymatic findings are concerned, so let me enzymatic findings. So whatever thing we can see over here within the enzymatic findings, we will see there will be the myoglobin. So the first thing that will come over here, the myoglobin that will come over here. Okay. Myoglobin will be elevated. The second thing we can see over here, that in this case is the the creatinine kinase. So I am writing it over here. CK stands for the creatinine kinase. Let me write it over here. Creatinine kinase. So that will be also elevated. Now within the creatinine kinase, there are 3 types of the creatinine kinase. So let me write it over here. CKMM, that is present within the muscle. Okay. Now if you talk about CKMB, that is present where within the heart. And there is also present CKBB. It's present within the where? Brain. Okay. Now we should say the patients. The patient should go for the what? That is related with the heart. So definitely we should say for this one. Okay. Now this will be elevated definitely. Okay. Now if you talk about in terms of the troponin, that is also one of the most important one. Okay. So troponin. So we will see the elevations of the troponin as well. Okay. In the 7 days alone, in some cases we see basically it takes 6 to 7 days to get elevated. So within the troponin we will get the 2 types of the troponin over here. That is the troponin I, and we will get troponin T. And we should say always for the troponin I is the most common one. Is the most common one, and the patient can also do troponin I. It's also important as well along with that. Okay. Now the next one, that we need to talk about the LDH. So LDH, whatever the problem we'll see over here. So let me show this part from here to here. I'm writing over here, okay. Whatever the problem we will see as far as the LDH is concerned. So under normal circumstances, what do we know, that the amount of the LDH2 that is much more greater than LDH1 under normal circumstances. I'm writing here normally or normal. But whenever you see this type of the infections or infarctions in terms of the myocardial infarctions, you will see we are talking right now. Then we will see in these cases that LDH1 that will be much more greater than the LDH2. So there is what? Flipping of the LDH ratio we are seeing over here. So we'll see flipping of LDH or ratio. So it's very easy to understand, okay. So this type of the enzymatic findings you can see over there, okay, as far as the enzymatics. And we can also do the echo, okay, as far as this thing is concerned. Okay, let me write it over here. We can do also the echo in case of hypokinesia. If we see the less movement, okay, we can find out the less movement of the heart over here. So hypokinesia or akinesia, we can say just to do the echo, okay. So this type of the normal findings, or we can say that diagnosis you can do in this way, okay. Now the thing is there, what type of the changes we will see in terms of the cellularities, and what type of the inflammatory process. If the inflammation keeps on go longer, then whatever the things changes we will see over there. I'll talk about these things in the next part of the videos, because if I want to start saying those parts, then it will take more time, the video will be longer, okay. That's why I'm just making it short. So in the next part of the videos, I'll talk about what type of changes we will see in the myocardial infarctions, and what type of the treatment we're supposed to do over here, okay. This type of the thing we'll see in the next part of the videos, okay. So if you just for the first time you are watching my videos, please do like, and so don't forget to subscribe my channels. And if you don't understand anyone related to this video, please let me know in the comment sections. I'll try to help you guys with my level best anyhow. And please don't forget to subscribe. Thanks for watching.